Hello everyone, thank you for joining our staff meeting. I am Heshha Chavda. I am the head of infection control, and today I will be briefing you all about chlorine gas and its preparedness for any infection or contamination. Now, chlorine is a chemical element mostly used in industries and found in many household products, most commonly in bleach. It is yellow-green gas under normal conditions. It smells like bleach. It is dissolvable and liquid when pressurized and kept cool. Who is the most susceptible to chlorine gas infection? Many household cleaners using chlorinated cleaning products, industrial workers, children, as well as swimmers. Now, what exactly is the infectious agent chlorine and what are the risk factors for the agent? It is a strong oxidizing agent and can react explosively and form explosive compounds. It may cause blurred vision, burning feeling in the nose, throat, lungs, coughing, chest tightness, a lot of respiratory issues such as respiratory failure, nausea, obstructive airway diseases such as COPD and asthma. Now, how can one get tested if they're infected or contaminated by chlorine gas? As of today, there is only supportive treatment available. There are no specific antidotes for chlorine. However, you may contact poison control. There are chemical agent detector kits that are available, hazmat smart strips, as well as the chemical identification equipment guide can assist the emergency first responders. Now, when is the infectious window for chlorine gas or when are they contagious? Now, people who are exposed only to chlorine gas generally do not pose risks of secondary contamination. However, clothing or skin that has been soaked with chlorine bleach may be corrosive to rescuers. Why is this infectious agent important to the staff, the patients, and the community? It Now the chlorine gas represents a hazardous material threat from industrial accident and act as a terrorist weapon. Large chlorine stores are vulnerable and lack adequate security. There have been some organizations that have demonstrated events of successful use of weaponized chlorine, resulting in hundreds of casualties. That's why this requires increased awareness in the community and planning. How do you protect the staff and how is it transmitted? Like we talked earlier, people exposed to chlorine gas generally do not pose risks of contamination. However, PPE is required. Using butyl rubber or other glove materials may be used to prevent any transmission. What are the other considerations that we can keep in mind regarding chlorine gas? At present, the recommended treatment of people suffering from acute accidental chlorine inhalation is only supportive and symptomatic. Um, Development of new therapies with trials in certain models could lead in enhancements in care of these individuals, as well as it is important to recognize the evolving threat that has been posed by chlorine both in the form of accidental release as well as unconventional weapon. Thank you so much. Please feel free to have any questions, feedback, or comments.